Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2 Lift and our expert on the microphone series. Today, we're joined by certified nurse practitioner, skin expert, and injector, David Weir. With over 23 years of devoted experience, his passion for beauty, skincare, and education is unmatched. He's a trusted source in guiding clients to achieve their best look and slow down the aging process. Personally trained by the esteemed Dr. Rohrich, David brings a wealth of knowledge and research on the latest cutting-edge, non-invasive beauty procedures to help patients look as good as they feel. He's going to join me today to chat all about the world of injectables and how CO2 Lift, once again, is supporting both results and recovery. Welcome to the show, superstar.
Thank you so much for having me.
I'm excited to have you on. So we're going to dive right in, straight to the point. You're an expert in non-invasive cosmetic procedures, particularly toxins and fillers. And interestingly enough, in the past few years, there's been a noticeable shift in patient preferences with more people opting for non-invasive treatments over surgical options. In your expert opinion, what do you think is driving the growing demand for these non-invasive procedures and products?
One is wanting to look natural. Okay, because I think there's a fear with surgery that you might not look natural. So people equate non-invasive with less severe of a result or something like that. And then I think my patients are also looking for minimal downtime. They don't want the downtime of surgery, weeks out of work, etc. I think with non-invasive, there's typically obviously lower risk, it's lower cost, and there's been a huge advancement in technology. So there's a lot of things that we could do now outside of the operating room that 20 years ago we would never thought or even imagine possible. I think as far as non-invasive is concerned, a lot of my patients are looking for a preventative uh, aspect to aging. It's no longer corrective work, it's more prejuvenation versus rejuvenation. And we can achieve that in the non-invasive aspect. And I think also with the tool of social media and the education that's out there, something like your show, is that people are now aware of the different aspects of non-invasive medicine that we can actually do to prejuvenate them or even rejuvenate them without having to go underneath the knife. And lastly, I really think there's been a nice cultural shift that there's no longer a stigma around having some of these non-invasive procedures done like there were about 10 years ago. So people are more readily accessible and more readily available to undergo some of these non-invasive procedures to look and feel their best. It's about a confidence thing, and people are no longer as scared as they used to be.
Yeah, people are very educated, and you're right. You're 100% right. Social media brings a lot of information at the forefront, and we can dissect it as fast as we want, right? At the fingertips. And
Yeah.
so that's a little bit different than your traditional approaches where you had to go to a website and look at the before and afters and read patient testimonials. Now it's right there in your face, right? Now let's bring CO2 Lift into the picture. As we know,
Mhm.
carboxytherapy has actually been around since the 1930s, injecting carbon dioxide gas underneath the skin, right? But CO2 Lift was able to remodel this in a new delivery system as a non-invasive topical gel mask, which is what we're speaking to. And while it has many monotherapy benefits, it can also be used in combo therapies, both pre and post procedure. David, what inspired you to pair CO2 Lift with injectables, such as biostimulators, in your practice, and how have you firsthand seen it improve a procedure's results?
I have been using a carboxylift since it's came to the market. I thought it was very anecdotal in the beginning because we only used hyperbaric oxygen in emergency situations typically to promote wound healing if we had a dusky flap or if we had tissue that wasn't responding post-surgery the way that we wanted to. So whenever I was introduced to this kind of novel gel concept of being able to have like a tiny little gel hyperbaric oxygen chamber that I could apply topically in my practice was very interesting for me. Now, when you think about biostimulators and how they work, they typically work by stimulating collagen in different pathways, whether it be an inflammatory pathway, whether it be a fibroblastic pathway. But for those typical biostimulators to work, they have to be in a environment that promotes for them to stimulate collagen. So with carboxy mask, you have this nice novel therapy that you can apply topically to boost things like oxygen, hydration. And these are things that you need when you're injecting biostimulators. So I think of biostimulators, probably the two most popular ones right now are going to be Sculptra and Radiesse. That when I'm injecting these products, I think of them as like fertilizer for my collagen. Okay. But where's the sun? And, Lana Kerr, who is a proponent, obviously, the CEO of Carboxymask, told me about this. And I started partnering it with my biostimulators because I was like, okay, if I am fertilizing the yard, what am I doing to give it the sun that it needs? And it makes total sense to pair Carboxymask with our biostimulators to increase oxygenation, increase the tissue moisture level, because that type of appropriate environment, that healthy environment, is going to make our biostimulators just work better.
Wow, I love what you just said. That's a great analogy. You put it so you paired that very nicely with those words. We should coin that.
Yeah.
You know, we need sun, we need
Yeah.
sun.
We
Now
need sun.
a major priority of patients today is minimal downtime, at least for me, and the shift towards non-invasive treatments is allowing that, and even following a non-invasive treatment, there are steps patients can take to continually reduce downtime and improve the healing process. What are the common challenges patients face during recovery from injectable treatments, and in your experience, how does CO2 Lift help mitigate them?
So, swelling and inflammation, number one. Anything that we do typically non invasive is going to have swelling and inflammation. And it should, because sometimes that swelling and inflammation is what leads to the result. However, we are in an era where patients are no longer patient. Okay, even me, like I want everything Amazon Prime same day. Like I don't want to wait 5 days for it to come. I want it the same day. So when we're doing injectables, some things that can happen are swelling and inflammation. So you have carboxy therapy that speeds up circulation and helps with lymphatic drainage. So, boom, swelling and inflammation is going to be decreased. Then you have bruising. If you're putting a needle on someone's face, obviously there's a chance of bruising. There's thousands of tiny little blood vessels. If you get a bruise, that might take 7 to 14 days to go away. So that's interfering with your result right in the beginning. And patients don't like bruising. So if I could put something on that's going to help increase oxygenation, increase blood circulation, increase lymphatic drainage, it's going to help mitigate that bruising a lot more efficiently. Next, redness and sensitivity. Post injection, we're using a lot of different things like hypochlorous acid, alcohol, chloroprep, different things to cleanse the skin. And those could be very irritating. So, using something that can restore moisture balance to the skin makes total sense to help with the microbiome of the skin and make sure that the skin is no longer irritated. So, carboxy therapy makes sense there. And then, of course, you have like dryness and dehydration, which, of course, carboxy therapy is going to help increase moisture. And then, lastly, like I said earlier with the Amazon analogy, patients aren't patient. We want results same day. And what I find when I pair my carboxy therapy with my injectables, that swelling goes away faster. The result tends to look better faster as opposed to saying, oh, wait a month, it'll look good in a month. I could say, oh, wait a few days and it's going to look pretty good. And patients nowadays, they want that kind of instant gratification. So carboxy is really cool that I can really pair it with a lot of my procedures to help speed up that process.
Wow, you are a scientist. Now, I want to touch on one specific challenge some
Sure.
patients face after receiving some fillers vascular occlusion, which is a rare but serious complication. What steps do you take to prevent and manage this issue? And how can CO2 Lift play a role in managing vascular occlusions and supporting tissue recovery?
Okay, well, this is the giant warning label that I have to talk about with every single injectable patient. And unfortunately, some patients have never even heard of the risks of some of the injectables that we do. And when we inject an implant into the skin, being hyaluronic acid or even a biostimulator, the greatest potential risk is that we may inject it into an artery. And if we inject it into an artery, it can actually stop the blood flow to the area of where that artery goes. Okay. And that can lead to ischemic tissue or the tissue dying. Okay. And there have been case reports all over the world of some very severe things happening as far as necrotic tissue, parts of people's faces dying and having requiring surgical intervention as far as like skin grafts, etc. Now, that is a very, very low chance of happening, but it is a real possibility. And there's even been reported cases of like things like blindness from injectable fillers. So it is something that your provider should be going over with you. However, Even though it is a low risk, I do have an entire tackle box in my refrigerator of everything proven to fix these things. Okay. In my career of over 23 years, I've only seen a couple of them. Okay. It's a very, very rare chance of it happening. But if you have cut off the blood flow to an area, the best thing you can do is reestablish blood flow, right? So, what are things that you can do to reestablish blood flow? I mean, there's tons of things that I could talk about as far as Hylenex to dissolve the product, vasodilators like Nitrobid, sildenafil, warm compress, massage. There's lots of things that we can do in office. However, most of the time, if there are severe cases of loss of blood flow, we send these patients to a hyperbaric chamber to reestablish blood flow. Now, in office, I have a tiny little packet that I can just slap a hyperbaric chamber right over the area that has loss of tissue perfusion. So this is very anecdotal, and I know they're studying this in certain parts of the world. I know Dr. Walker in the UK is looking at this specifically because he's part of the CMAC conference that looks at global adverse events and how to correct them. However, if we can apply something that's going to increase oxygen perfusion to the tissue, if we have inadvertently affected arterial supply, it makes total sense.
Yeah.
So, carboxytherapy is
Wow.
another thing that you can have in your rescue kit or your toolbox as a way to increase patient safety in your clinic. Now, these things are very rare, but they are a real possibility. And there's one of the, it's like the crash cart. Like in the
Yeah.
hospital, you have a crash cart. You don't ever want to use it, but you need to have it just in case. And this is something that I have in my crash cart.
Wow. CO2 Lift never ceases to stop amazing me. I mean, these endorsements and these testimonials are number one, 100% organic, based on facts, reality, and real anecdotal information. Like you said, no one is paying you to say this stuff. No one is forcing you to say this stuff, but you explained it so nicely. And the fact that it's such a saving grace in medical procedures is as a combo therapy, like you said, monotherapy is so rewarding to know that you have a product that is basically working wonders on many, many different fronts.
Mhm.
Which brings me to my next question. We have about 2 minutes left, and I
Sure.
want to get through this one and one more. So I know education is also of the utmost importance to you. You were trained under the renowned plastic surgeon, like we just mentioned, Dr. Rod Rohrich, and he has contributed on our show in the past. And as a self proclaimed research nerd, you are actively involved in ongoing studies for the
Mhm.
FDA and top aesthetic brands. So
Mhm.
why do you believe education is crucial in this field for both students and practicing professionals, especially in an era of such rapid advancement?
Because I think it is an era of rapid advancement. We are only as good as we were yesterday. I look at things that I was doing 20 years ago and I laugh. I really laugh because I'm like, I would never do that again. I look at things that I did 10 years ago or 5 years ago and I'm like, oh my gosh, I can't believe I did that. Now, as someone who treats my patients based on evidence based literature and based on what the research and the science is telling us and directing me to give my patient the best actual treatments to get the best results, that is changing on a day-to-day basis. Over the I could go over, I mean, if we had another half hour, I could go over things that I learned in the past 3 months, new advancements in non-invasive aesthetic medicine that have kind of changed my practice. And this is just in the past 3 months. So as an evidence-based practitioner, I have to make sure that I'm staying on top of what the research is telling me to make sure that I keep my patients safe and also to make sure that I'm giving them the best treatments to get the best outcomes.
Wow, I love it. Okay, so now we're going to touch on exactly what you just said. So before we wrap up, what emerging trends or technologies do you see shaping the future, of injectables and skin rejuvenation as a whole, and or the ones that you've implemented in the last 3 months? I'd love to hear about them.
Yeah, so I think the biggest trends right now, of course, are going to be biostimulators. Okay. Everyone's talking about biostimulators. They want their body to do the work. They don't want implants. They don't want synthetics. They want something natural. However, I'm a giant proponent of hyaluronic acid fillers. And what people don't understand is even though hyaluronic acid fillers are considered implants, they are biostimulatory in their own right. They can stimulate collagen. So there still is a place for them in the realm of biostimulation. Regenerative aesthetics, there's a lot of area of opportunity to study in this as far as like exosomes and PRF and stem cells and all these different things that focus on biorejuvenation. So regenerative medicine is and functional medicine is huge in the next coming years. And I think with the patient demand, of getting better and better results with less downtime and being more and more minimally invasive. So the ultimate goal, and I laugh with Dr. Rohrich about this because we had a conversation, and he said, "What's your number one goal in your career, David?" And I said, "To put you out of business." And he was like, "What do you mean?" I was like, "Ultimately, as a non-surgeon, I want my patients to get surgical results without having to have surgery." And we're not there yet. We're not there yet, but it is one of those things that is the ultimate goal of non-invasive aesthetics, and it will get there eventually. And I
I'm
think,
sure he loved that.
yeah, he did. He laughs about it. We joke with each other.
Yeah.
But as the technology continues to advance, we're going to get more and better results with less downtime. But the kind of warning that I put on that is because there is so many technologies coming out so quickly that they're not all vetted to the same degree at the same level. So there has to be a consumer warning to all the patients out there. Like, just because it says it's good on the internet doesn't necessarily mean it's good. So you have to make sure you're going to a practitioner that's really following the evidence and making sure that they're giving you the best treatment that is going to yield you the best result in their hands.
You said it. And with that, we are out of time, my dear friend. It's been such a fun date.
Yeah, thank you.
I really enjoyed talking with you. I thank you so much for your
Yeah,
expertise, your knowledge. Truly, not only does it show that you do your research, but it really shows that you care about your patients and patient outcome and that you put them first. And that's priceless.
yeah, thank you.
That's a wrap, my dear friends. That was our Going Deep segment brought to you by CO2 Lift. And that was the incredible David Weir, certified nurse practitioner, skin expert, and injector. Definitely be sure to check him out on the gram at Ultimate Skin Source to stay up to date with his work and the latest in the field. And you can also head directly to his website, ultimateskinsource.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to CO2Lift.com.